Well, it is the season where we see a rise in cases of the common cold, and for that reason, we are paging Dr. Paul to get his advice on how we can protect ourselves as well as our kids. Good morning to you, Dr. Paul.
Good morning, Will.
It seems like everyone's gotten sick over the last few months, and I think it's important that we describe first what causes the common cold.
Sure. There's 100 viruses that can cause this, okay? When I talk about the common cold, I'm not talking about the flu. Different, right? The flu is much more dangerous. So this is a common sniffles, runny nose, bit of a fever, a couple of days goes away. That's what usually happens. So there's a multitude of viruses that cause it, and so that's why there's no cure. And the other thing too is that because they're viruses, antibiotics don't work. So that's why I like to talk about it, because parents have a lot of misconceptions and questions about it.
Right, so it's just like at this point when you get the common cold, you just got to battle through it.
Exactly.
So no one likes being sick, even regardless of whether it's that cold or not. So how would we prevent our kids specifically in maybe obtaining that cold?
Well, you know what? It's the same old thing that we talked about with COVID and everything else, because these are respiratory. So they cough and sneeze into your sleeve, those type of things. Stay home when you're sick, etc. And also, when you're coughing and sneezing, sometimes it can go onto a desk, onto a keyboard, and so other people can come in, touch it, and then infect themselves, because this is respiratory. You breathe it in, right?
Right.
And so washing your hands frequently is a very important thing, and also disinfecting common surfaces. So the usual stuff that we talk about, preventing flu, COVID, and so on, because they're all respiratory. They're in the air and they spread that way.
So when in doubt, if you see some sanitizer or an opportunity to wash your hands, especially this time of year, just go for it.
Sanitizer, yeah, exactly. Go for it. Go for it.
So now we've obtained the cold. We did not follow your prevention protocols.
Exactly.
Now we've got the cold. What are some options that we can do from this point?
Well, the first thing is, I try to stay away from medications, and we'll talk a bit about that later. But for the most part, it's trying to keep a child comfortable, especially if it's a child, right? You want to make sure that despite the fact that they have a congested nose and coughing and sneezing, they can drink, they can feed themselves. Okay, that's the one thing. So plenty of fluids. If they're not feeding, that's fine, as long as they're drinking well. Very often they get nasal congestion, and particularly younger babies, you can actually help them with a little saline pump, put a bit of salt water in the nose just to clear it out. And those are the type of things. And also I like humidity. Cold humidity, cold mist humidity, not warm humidity. Cold mist humidity actually helps them breathe better and humidifies the airway so they can have a better time sleeping. Because the main thing that it gets in the way of really a child behaving normally. So, and the two things that you want to make sure is that are they sleeping well and they're feeding well.
It is amazing what a good night's rest can accomplish, especially when the system is feeling down. That sleep can help you recover better, right?
Exactly.
Okay, final one we have today is over-the-counter medications.
Yeah, and the reason I want to talk about this is because, we've changed our thinking about these things. So a lot of you go to the pharmacy and there's like rows and rows of, over-the-counter medications, cough syrups, decongestants, those type of things. So the first thing I want to say is that those medications are not really supposed to be given to children less than 6 years of age. That's really the most important thing. Okay. We used to give it to younger kids, but there was a lot of side effects. So for younger children less than 6 years of age, it's really the treatments that we talked about, symptomatic treatment and so on. And so we have three types of these things. So there's decongestant, D. So very often you see on the bottle, it says D, DM, and E. So D is a decongestant to decongest the nose. DM is dextromethorphan, is for a cough. And E is expectorant. Now, some of them have three, some of them, I don't like to use them a lot, except if in an older child or a person, if they have coughing at night, for example, and it really keeps them up, maybe something that just has DM in it. The other thing too is when they have fever, these medications, like the decongestants and so on, do not address the fever. So if a child has fever and is otherwise well, you can give them something like acetaminophen, Tylenol, ibuprofen, those type of things. But those do not treat the cold, they'll treat the fever. But you know what? The good news, Will, is that for the most part, most of these go away in a couple of days. And if they persist longer, obviously, and have other symptoms, child not able to feed themselves, that's when people should seek medical attention.
Love that. Well, again, especially this time of year, getting a little bit colder, the common cold definitely spread amongst many of the kids, providing some knowledge and some relief. Dr. Paul, we always appreciate your time.
My pleasure.